Don Boyd is a veteran healthcare leader here in Western New York, and he's the Chief Operating Officer at Kaleida Health. Don, thanks for joining us today.
Thank you, Mike. Appreciate the opportunity.
If you can start out, explain to our audience who Kaleida is these days and what makes up the organization in terms of facilities and locations.
Okay. Yeah, I'd be happy to do that, Mike. So oftentimes healthcare organizations get described in terms of the revenue that they produce for the patients that they see. So Kaleida is a $2 billion organization. But I think to your point, what's more important is the depth and the breadth and the scope of the services that Kaleida provides. So Kaleida, we operate 9 hospitals in 2 states, in New York and in Pennsylvania. And when you look across those 9 hospitals and those other sites of care, we have almost 15,000 employees. When you look at the care that we do provide to the 8 counties of Western New York and the 1.5 million residents, we make up about 50% of the inpatient discharges that occur in Western New York. And then when you add and you look at the scope of what we provide, we obviously have Western New York's largest home care provider in the Visiting Nurses Association. We have our 2 skilled nursing facilities, one at DeGraff and one at High Point in the city of Buffalo. We operate the community's largest hospital-based center for laboratory medicine. And then through our relationship with UB, University of Buffalo, we're the largest medical student and residency training program. So when you put it all together, Kaleida certainly has a significant impact on healthcare in Western New York.
So with that said, talk a little bit about how 2019 ended and as 2020 began, some of the challenges and changes in healthcare. This is prior to COVID-19. So maybe a little bit about the landscape of healthcare and how it impacted the organization.
Okay, sure. So healthcare as an industry is facing significant pressures and challenges. And I think in 2019, what Kaleida experienced is very similar to what's being experienced across the state and across the country. So really 4 things come to mind, Mike. So declining reimbursements. So due to continued pressure from a federal and a state budget point of view, there's a decline in reimbursement from 2 significant payers, Medicare and Medicaid. And then couple that with just increased competition for physicians in particular specialties, and also a shortage of physicians and sometimes staff in key specialties as people are, as we look at the aging of our community and people are leaving the workforce. The third challenge is, obviously healthcare has gone through a tremendous technological change and a lot of advancements that improve the quality and care that's provided to patients. But there's a cost associated with that in terms of the technology, the supplies, and pharmaceutical expenses as well. And then the last piece that everyone's adjusting to is really that continued shift from the hospital. More and more care is being provided in the community, whether that's at the VNA, for example, in a physician's office or an ambulatory surgery center. So coming out of 2019, those were some of the challenges that we faced. And we worked really hard as a team at the end of 19 to put together our priorities going into 2020 about how to respond to that. And then COVID happened.
So we'll pick up there with COVID-19 happened. It's springtime, winter's ending. There's a lot of talk nationally and across the state about the coronavirus. And, the plans are underway at Kaleida in preparation for potential for these patients to start arriving at our doors. So if you can, take us back to that time when the first case hits in Western New York, and then, how you organize the team and the organization around a response to COVID-19.
I might even go back a little bit further. One of the things that I think we were really fortunate about was back in January, we, recognizing what was happening across the country and the world with COVID, our team came together and set a series of organizational priorities, realizing what was being predicted to come to Western New York and to Kaleida. So first and foremost, we want to make sure that we're going to be able to continue a safe environment for our patients, our visitors, our staff. So in January, February, and March, Mike, our team really came together and laid out a steering committee structure that really guided our plan and our implementation of what our response would be to COVID across the areas that we believed were going to be important to make sure that we could meet that number one organizational goal of providing a safe environment for staff and patients and visitors. So we did all of that even before we had our first case. Then when we started to experience cases in Western New York and we started to see the prevalence increase and people were being cared for in our hospital, we really pivoted into what we call a command center structure. So where you brought a diverse group of leaders together from across the organization who were working morning, noon, and night to coordinate the response based on the ever-changing situation and circumstances in the health system to assure that, back to that broad system of care that we talked about in your first question, that wherever a patient or a staff member was, we were ensuring that we had the appropriate staff, the appropriate supplies, that we were communicating effectively so that they could take care of the patients that were presenting to them. So during our peak, that command center coordinated that entire response across the system. And we really worked hard to take a leadership role in coordinating a response across the community as well. So working with the Erie County Department of Health, working with ECMC, working with the Catholic Health System, and with other providers across the region, sharing what we knew, learning from them, and incorporating best practices so that we could have a community-wide response to the pandemic.
So Don, you talk about COVID-19 hitting Western New York, the organization organizing its command center structure. So if you look back now at those days in March, April, May, while extremely hectic and time consuming, if you can, for the viewers who are watching, obviously an atypical situation because we're in crisis command type mode. But tell us what a typical day looked like for you in particular as you try to help organize the entire organization's response to the coronavirus.
Sure. Well, I think for our entire team, certainly they were long days, early in the morning and often late into the evening. So we would start our day with an organizational-wide call to really assess and understand how the organization performed over the last 24 hours in response to the pandemic. And then we were also using that call to look forward over the next 72 hours. What could we expect? What were we learning? What was changing? What was changing inside the organization? What were the changing recommendations that were being shared either at the state or the national level that needed to impact our response? And then planning accordingly for that. And then working closely with yourself and others to communicate. How do we just continue to update the organization, keep people abreast of what the changes were, what the change in the guidance was, how we needed that to impact how they were acting, behaving, and responding, and then coordinating a response externally and educating the community about what we were doing. So a lot, and then a lot of relationship and contact and discussion rounding throughout the facility, rounding on our staff, rounding with our physicians, rounding with our leaders to really learn more about what their experience was and how we had to continue to adapt and change our plan to ensure that they had what they needed to care for their patients.
When you look back, we're 5-6 months away from that entire disaster operation. But if you have a chance to look back at that, and not to minimize it, COVID-19 is essentially become another thing that we're treating in our facilities. So, we're averaging maybe a dozen or so patients a day across the organization who are inpatients that are positive. That's maybe a little bit less than 10% of what the peak was here. And not to minimize that, but how do you stay focused and have a one foot in the camp of we have to get operations, we have to get the organization back running again, but also looking at it from the sense of we have to have an eye on this to make sure that there's not a second wave that comes. And if it does, we need to be ready. How do you balance that act?
Sure. So we talk about it trying to do three things simultaneously. So the first was we needed to respond and continue to respond to the pandemic because we still are caring for patients, although the numbers are much smaller than they were during the peak, as you point out. So we needed to respond and continue to respond. The second is we need to recover. To your point, we need to pivot back into our more normal course of operations because there's a number of people that still require care, non-COVID related, that during the pandemic either delayed care for a variety of reasons, either due to the fact that we weren't performing elective surgery or they were planning to do it after services were back and open. So, and then the third piece is how do we, as we call it, reimagine? How do we take and apply the lessons that we learned through the first instance of COVID, which there are a lot of great internal lessons. There's a lot of lessons from across the region, across the country. And how do we incorporate that information back to our desire to continuously improve and be better and learn as an organization so that if we do have a spike in cases in the fall or whenever it occurs, we can apply those best practices. So our focus has been how do we adapt our plans and look at across 4 dimensions, Mike? So space planning. So if we have an increase in cases, how do we appropriately assure that we have the surge capacity that's needed and to care for those patients? Again, focusing on our staff, focusing on what their needs are, their emotional well-being, the supplies that they need, the competencies that they need, really learning from them, engaging them in what they experience and how we can do it better. And then the third is supplies, right? So there's been a lot said about PPE. Thankfully for our organization, even during the pandemic, we had a really good jump on our plan. We had done a lot of work to secure product. We had phenomenal response from the community with their donations and with leads. And then our purchasing and supply chain team has done a phenomenal job of continuing to source products. So we continue to build our inventory and days on hand in the event that we do have a surge. And then the last piece is testing. I think it's been well documented, the importance of testing. And so we've continued to be a leader in Western New York in the testing that we're providing, not only for our patients and for our staff, but we're working really hard to build additional capacity, because as you look out in the future and you look at, you mentioned kids returning to school or people returning to college, and the need to be able to increase our capacity of testing and have a diversity of platforms to test on, so that if there's an interruption in supply chain or there's a hot spot somewhere else in the country, we're able to continue to provide that service for our community. So it's really trying to do all 3 things simultaneously. Continue to respond to COVID, restarting our operations, which has gone extremely well with patients coming back for care that had been delayed, and then learning and applying the best practices from our first instance so that we can manage and respond even better than we did the first time.
Someone saying that when you take those 3, say, guiding principles or the direction that you're trying to move the organization in, what's a concern? What keeps you up at night? What's the unknown that you're looking around the corner for?
So I think the thing that I probably think the most about, and I know our team does, is really around the concern for our staff. This is, you look back on the last 4 or 5 months, it was, obviously a very trying time and a very emotional time. And that hasn't ended. So when you look forward at the challenges that each individual needs to navigate and face in their own personal life, we're spending a lot of time focused right now on how do we support our staff with return to school. So each school may be taking a different approach, a different strategy. And so how do we support them? People, going off to college, is your child going off? Are they not going off? Are they coming back? How do you manage that? People with elderly parents. So I think a lot of our time, energy, and focus is really on assuring that the needs of our staff are being met. And that's really where my biggest concern is making sure that they have what they need from ability to take care of patients, and then the emotional support and well-being.
So you mentioned staff. I guess we'll wrap up with the final question. And when you think about, the organization's phenomenal response, it obviously starts at the front line. A message for the staff overall. What are you most proud of? What would you like to say to them as we wrap up here?
Yeah, thank you for the opportunity to do that. It's been said many times, but it can't be said enough that the true heroes in all of this are those frontline workers that cared for patients and supported each other during the pandemic. So what I'm most proud of, Mike, is the team's response and how everybody in the organization just came together with a singular purpose, with a singular focus, how they supported each other, how they responded and delivered for our community during my 22 years, which has been the most challenging period of time in healthcare. So the fact that they came together in the way that they did and how they did it, and they did it without question, and just delivered for Western New York, to me is really, it's awesome. It's one of the most proud things I've had an experience in my career. And it's just really heartfelt thanks and gratitude for them for what they did, but more importantly, how they did it. And it speaks to the quality of the people that are at Kaleida.
Well, it can't be said enough. An incredible response by the organization. That starts with the frontline employees. But thanks to you and your leadership, helping Kaleida Health move forward, not only get through COVID-19, but looking forward to the fall and a potential spike here. So thanks for all that you do. And thanks again for joining us today on Medically Speaking.
Thank you, Mike.